So, good evening. In the OPD, if we are counseling the CKD end stage patient regarding renal transplant, the attender or the family members might be having the doubts regarding the renal donation and what are the basic investigation they have to do before going to the center for renal transplantation. So, in that regard, we will see this video. This will act as a summary. What are the tests they have to get it done before going into the further evaluation. So I was thinking to make the video in the Hindi. Probably whoever going to see this, I will try to add the subtitle in Hindi. So in case if any patient or attender is watching this video, probably that might be helpful to them if they are not knowing English. So the investigation for the donor evaluation can be divided as three parts. One is to check whether the donor is suitable for donor kidney donation or not. Further is the immunological workup, how the kidney is going to do with the recipient, whether immunologically both are matching or not, and some investigation per se. For example, angiography, which are related to the anatomy or the surgical aspect, some clearances, which are the final step. So in the beginning, what the donor or the attender want to know whether a particular person is eligible or not. For that, again, we can divide the investigation into blood related investigation, what are the things they have to do, urine related investigation, what are the things they have to do, and the imaging related investigation. And finally, to check whether the kidney is functioning, whether it can be given to the donor or not, final comes the TTPA scan. This completes the preliminary investigations. So going one by one, first, before going to the blood investigation, the age of the patient. Age preferably have to be less than 60 and more than 80. These are the age group where donation is possible. Suppose if more than 60 years, less than 18 years, it's not absolute contraindication. It varies from case to case. At least for these kind of general discussion, the age have to be less than 60 for the better outcome. So first the blood investigation. What are all the blood investigation the donor have to do first? We have to get the CBC done, which include hemoglobin, total count, platelet, preferably peripheral smear, kidney function test, which include urea, creatinine, and the uric acid, electrolytes, which include sodium, potassium, calcium, and phosphorus. The last one is the LFT, which is bilirubin, SGOT, SGPT, and the total protein and albumin. So these investigations have to be done. Preferably, everything have to be in the normal range. If it is abnormal, there's a chances evaluation for that particular abnormality will start. CBC, KFT, electrolyte, LFT, and investigation related to the diabetes, which is fasting blood sugar, postprandial, and HbA1c. HbA1c preferably have to be in the normal range. If it is on the higher side, diabetic patients are not eligible if there is a end organ damage in the form of retinopathy or cardiac or microvascular or macrovascular complication is there, they are not eligible. So at least for this discussion, I will keep just what investigation to be done only. So thyroid function test, which include free T3, T4, and TSH have to be done. Viral markers, which include HIV, hepatitis B, and hepatitis C. This have to be done. The last one is the lipid profile. To make sure the patient is not in dyslipidemia, BMI should be in the normal range. If it is on the higher side, patient comes under obesity. Till the time patient brings the BMI to the normal range, probably the donation might not be taken. So on the blood side, we have seen 9 investigations, preferably everything to be in the normal range. Then going to the next set of investigation, which are urine related. In the urine, basically we have to prove patient is not passing any amount of protein in the urine. How to check it? Just check for urine routine microscopy to look for pus cells, protein or sugar. Urine PCR. PCR is a shortcut to check how much amount of protein the patient is excreting, which is protein creatinine ratio. And probably some patient might be having the doubt why, if it is PCR is already done, why 24-hour urinary protein? There's a double check to 100% sure patient is not releasing any protein in the urine because the patient is going to donate it, it is of utmost importance. The last one is the urine culture. So these are all the 4 investigations which are related to the urine which has to be done. Next, coming to the imaging investigation. So what are all those in this imaging? Chest X-ray, ECG, basics for any kind of surgery. Here for donation also. Echo have to be done. There should not be LVH. If there is a LVH, high chances the patient might be hypertensive. Probably the chances of donor being ineligible is high. X-ray KUB to look for any kind of stones. Despite that, USG abdomen and KUB will be done. Depends on the age of the patient and the gender. Mammography or USG of the breast if it is a female have to be done. And as per the particular donor condition, other imaging investigation might be required. But these are all the basic investigation. If all these are normal, yes, the donor is eligible. Then subsequently this DTPA scan will be done, which is to check the EGFR. The radionucleotide scan. This will tell what is the exact GFR of the each kidney. Ideally, it have to be more than 70 to take for donation. The cutoff might vary from center to center, but whatever the cutoff I'm saying is mostly being followed in many centers. The normal is above 90, even above 70. The both the kidneys milaki, like combining both the kidneys, it should be more than 70, and there should not be gross difference between the two kidney EGFR. So this completes that patient is eligible for donation. So if you do all these investigation, then further evaluation for immunological workup can start. Because immunological workup is little bit costly, before going to that, to get this investigation to see the eligibility, then proceed further. And if you are going to the government center for transplant, these are investigation they are going to do at the beginning. So what we have seen is the blood investigation, urine investigation, and the imaging investigation. So in the blood, we have seen CBC, complete blood count, kidney function test, liver function test, electrolytes, HbA1c, FBS, PBS, thyroid profile, viral marker, and the last one is the lipid profile. So this completes the blood investigation. In the urine investigation for urine routine microscopy, urine culture, urine PCR or ACR, 24-hour urinary protein. In the imaging, you have to do the chest X-ray, ECG, 2D echo, X-ray KUB, ultrasound, and one investigation as per the patient gender. So this completes the basic investigation. Once these are normal, DTPA scan will be done. If the DTPA scan shows the kidney EGFR more than 70, that means the basic investigation for the donor suitability is done, and the donor is eligible to proceed to the next investigation, which is the immunological workup. At least till here, the donor or the end stage renal disease patients, these amount of investigation you have to do at least by based on the values only will come to know whether the eligibility is there or not, so that you will be avoiding multiple visits to the transplant center. So that's all regarding this video. So as I told, we have seen only the investigation which are for the suitability or the eligibility. Immunological workup we didn't see, and regarding the transplant, per se investigations are there that will come once this suitability is met and once we proceed to the next one. So that's all. Thank you.